close till I get up. Time is barely on our side. I don't wanna waste what's left. The storms we chase are leading us, and love is all we'll ever trust. Yeah, no, I don't wanna waste what's left. And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways, and on we'll go.
This videotape will provide the viewer with the basic steps for feeding a dog or cat through a gastrotomy or stomach tube, as well as the care and maintenance of the tube site. Gastrotomy tubes must be tightly capped when not in use. They are usually capped with a catheter adapter and plug. A three-way valve can also be used, in which case the valve handle is pointed toward the tube when the valve is off to the patient. If feeding a liquid diet, remove only the plug so that the syringe fits into the catheter adapter. If using a blenderized diet, remove both the plug and adapter so the syringe fits into the feeding tube directly. Always offer the animal a small amount of fresh food to eat before feeding through the tube. As the animal's appetite returns and it begins to eat on its own, consult the veterinarian for guidance in reducing the tube feedings. To be sure the tube is clear, inject 3 to 4 milliliters of water through the tube before each feeding. If you cannot inject the water, or if the animal begins to cough, vomit, or act painful, do not continue feeding. If you are satisfied that the animal can be fed, have it sit up or lay on its right side and feed slowly over 5 to 10 minutes, no more than 20 milliliters per minute. Feeding should be warm to room temperature. If it becomes difficult to push the syringe, stop and check that the feeding tube has not kinked. If the tube is not kinked and you still cannot get the food to flow in easily, or the animal vomits at any time, you should stop feeding and call the veterinarian. After feeding, thoroughly flush the tube and leave it filled with water to prevent the tube from clogging with dried food. Again, use about 3 to 4 milliliters of water to flush the tube and then replace the cap. If using an infusion plug and adapter, pinch the feeding tube shut after flushing with water and then replace the plug. If a three-way valve is used, flush with a syringe and point the valve handle toward the tube before removing the syringe. Watch the animal for a few minutes for any signs of discomfort such as colic or diarrhea. Signs that may indicate a problem with the tube include abdominal swelling, vomit-like drainage where the tube exits the body, or vomiting. Record the time you feed the animal and the total volume given at each feeding, including the water used for flushing the tube. Also, record any problems. Do not administer anything through the feeding tube except the feeding solution without permission of the veterinarian. Refrigerate any unused food. Food should not be left out at room temperature for longer than 4 hours. The tube site should be checked before each feeding. Most animals will have a body stockinette covering the tube site. If there is a wrap or covering over the tube site, you should remove it at each feeding and examine the area for redness, tenderness, swelling, irritation, pus, or any stomach leakage. Inspect the tube for inward or outward movement by checking the position of the mark made on the tube at the time of placement. If the tube appears to have migrated, stop feeding. Most dogs and cats will keep the skin around the tube site clean. You should cleanse the skin with an antibacterial soap such as Dial and water only when necessary. Use a spiral pattern beginning next to the tube and moving outward. Dry this same area thoroughly. If the tube has a rubber bumper on the outside, clean under the bumper with a cotton applicator if necessary. If any crust is present around the tube site, remove it using hydrogen peroxide diluted to half strength with water. After removal of the crust, rinse the same area with water and dry well. If a bandage dressing is used, change immediately if it becomes wet. Successfully feeding and caring for your animal when the stomach tube is in place is not difficult if the instructions are closely followed. It is, however, very important that you make careful observations of the animal during this time. If you notice any of the described symptoms, have any difficulty in feeding, or have any questions concerning feeding or care of your animal, do not hesitate to talk to your veterinarian.